Hey you. Yeah you. Look up here. Have you ever heard about Huntington's disease before?
What is that?
Well, do you want to know about it?
How about no?
Too bad, let's learn about Huntington's disease.
No!
Huntington's disease, also known as HD and Huntington's chorea, is a genetic disorder. That means the disease is inherited, so you won't catch it by standing near someone who has the disease. Huntington's disease is caused by a mutation in the HD gene, which was mapped on chromosome 4 in 1983. I always knew there was something fishy about that chromosome. Anyways, Huntington's disease causes a progressive breakdown of nerve cells in the brain.
You are dead! Not a big surprise.
So I will let you guess some symptoms. Okay, your time is up. I don't know what you answered, but I'm guessing you're wrong. Huntington's disease usually causes movement, cognitive and psychiatric disorders with lots of symptoms. Some of those symptoms are involuntary jerking or writhing movements, slow or abnormal eye movements, difficulty organizing, prioritizing, or focusing on tasks, lack of impulse control that can result in outbursts, acting without thinking, and sexual promiscuity, feelings of irritability, sadness, or apathy, frequent thoughts of death, dying or suicide, behavioral problems, changes in fine motor skills that might be noticeable in skills such as handwriting. And there is more. So as you can see, Huntington's disease is a dangerous disease. Only it isn't common. Only about 5 to 10 people per 100,000 in the UK have the disease, and it's more common in countries like Africa and Asia. The offspring of parents which only one has the disease has a 50 to 50 chance of getting the disease. The fortunate part is that, if you don't have the disease, you could never pass it on as the gene is dominant. With this disease you can't prevent it, but prevent it for your children. This is how you prevent your child to have Huntington's disease. Step 1. Check if you have the disease. If you don't, then you lucky duck. If you do have it, continue. Step 2. Choose whether you really want to have kids. If you do, then consider vitro fertilization, which is basically doing the fertilization in a lab and check the embryos for the gene. And that's how to have kids when you have Huntington's disease. As of right now, there is no cure for Huntington's disease, but treatment may, just may, help. Now there are organizations out there that help people with Huntington's disease, like Huntington's Disease Society of America and the International Huntington Association. And now you are a master at Huntington's disease, unless you were sleeping the whole time, which means you are going to be left out.